Hello guys! A man went to get a haircut, not knowing that it will end his life. Tony, in his late 20s, went to the barber shop to get a haircut. There was a waiting line. He waited for a few minutes. Then the barber asked him to sit on the chair where he was gonna wash his hair. A normal procedure done before getting a haircut. He sat on the chair, tilted his head backward, and just then he felt that his neck was stretching and spasming. A very weird kind of pain clumping on his neck. He did feel that the pain was radiating up to his skull, but it wasn't enough pain for him to ask the barber to stop or straighten up his position. He had no time, he had to go to work, so he decided that he's gonna bear with the uncomfortable situation until the hair washing is done. And that was his mistake. A few seconds later, he suddenly felt a sharp dizziness. Right here, he asked the barber to stop, and he stood up directly. He almost fell after standing up. He started to lose his balance. They sat him down on the chair. He thought that he's beginning to feel okay. He finished his haircut and went directly to his home, while still feeling dizzy. No pain, just dizziness. His home was near the barber shop. 2 minutes from entering his home, his dizziness became worse and he started to feel very nauseous, and just then he fell on the floor. Lucky for him, his brother saw him and called for the emergency directly. Inside the hospital now, he had an elevated blood pressure. Limbs movement were so weak, and Tony was unresponsive to the doctors. Any questions they were asking him, he was not responding. A CT scan to his head showed that Tony was having a stroke. It was a shock. 29-year-old, non-smoker, no past medical history, no chronic diseases whatsoever, but somehow he's getting a stroke. Why? To better understand the situation, you have to understand what exactly happened when a clot closes a single point inside the brain. This point will cut off blood from reaching the tissue. If the blood cannot reach the tissue, then no nutrients can reach and no oxygen can reach this tissue. Thereby, the tissue cells is doomed to be dead. And this is decided by how much time the stroke is still existing. The consequences here become more dangerous as more time passes without reaching the hospital and proper treatment. It ranges from brain damage, breathing problems, losing some function of the organs, half paralysis, and even reaching death. The most common types of stroke that happen usually in the brain are ischemic stroke. Usually when it happens, you cannot feel any pain because we don't have causal pain receptors inside our brain. But luckily enough, your brain gives you multiple symptoms and chances to save yourself before it's too late. And with symptoms, you should be fast. F-A-S-T. F referring to face dropping. You will look directly to the face of the patient who you suspect is having a stroke and notice if the two sides are symmetrical and parallel. A part of his mouth, left or right, dropping down. A refers to arm weakness. You will ask the patient to raise both of his hands like this, just like this, and you will just watch. Pay attention if one hand is dropping without the notice of the patient. It will be dropping alone. That's a clear sign of a stroke happening. S refers to speech difficulties. You will ask him to say his name, to read some words, a clear sentence, and you will notice for any slurred speech or stuttering. If he does, that would be a clear sign of a stroke happening. Now, T is time. It's about how much time you have to reach the hospital with the least consequences possible on the body. Now, they taught us that a stroke takes like 3 hours to kill, but sometimes it can take less. Every minute passes makes it even worse. You have to be very fast about it. You can as well use some blood thinners like aspirin, and that's according to your body condition. You have to talk to the doctor for the conditions of such emergency. Now, the main question is how such stroke can be triggered from a haircut. In April 1993, there was a claim from a certain hospital which described 10 cases of patients with stroke directly after visiting a hair beauty salon, and exactly sitting on that chair that is being used to wash the hair before getting a haircut. All of those chairs, apparently you have to tilt your head, and all of the patients were between 54 and 64 years of age. And this very, very rare condition is called beauty parlor syndrome, or vertebral artery dissection from hyperextension of the neck. So the problem is not solely with extending your neck, it's about extending this vertebral artery we're talking about. Why? Because this artery exactly is engraved between bones, just like you see in the picture. Any sudden hard or sharp movement, suddenly or for a long period of time, uncomfortable situation, could put this artery into such risk. It is a very rare condition that you might as well get it from swimming, basketball, bungee jumping, sneezing. Yes, that's how rare it is. So just to be cautious next time, especially if you are bothered when you wash your hair and tilt your neck backward, try to kneel your neck forward, not backward. Back to the hospital, Tony was saved just in time, without any consequences, all thanks to his brother that noticed the alarming signs just in time. That was the episode for today. Stay tuned for more uncommon bodies. Adios, amigos.